Hello and welcome to this week's What Were They Thinking? We begin with news on the CCP virus, and some of our concerns from past weeks have been vindicated at last. As summer in the Northern Hemisphere is coming to an end, and children are beginning to return to school, if they haven't already, we now need to look at the fact that they may be carrying just as much of a viral load as their adult counterparts. For months now, the argument has been that children should go back to school because we have nothing to be worried about. They don't seem to be infected by the CCP virus. This means that they are safe to go back as they won't catch the illness and they certainly won't spread it. Unlike adults, the concern was that adults would readily spread the disease. The difference between these two, for the most part, has been that adults have the ability to not only identify when they're ill, communicate it, but also act to limit the exposure others have to them. Children, on the other hand, don't exhibit symptoms, don't communicate effectively, and often lack self-control. Recent research has indicated that children who have it may not have the same symptoms as an adult, but they may have just as much of a viral load. This means that they pose a threat of spreading the disease just as much. A sort of Trojan horse, if you will. The study that we're looking at is considered one of the more comprehensive out there. It examined just under 200 children between the ages of 0 and 22. What they found was that there were 49 children who tested positive for the CCP virus. There were also 18 who had multi-system inflammatory syndrome, a condition related to the CCP virus. This is a nearly 30% incidence among children, substantially higher than what occurs among adults. The reason we might be seeing this is that for the most part, adults communicate as we've mentioned, whilst children do not. Adults show symptoms, children do not. And ultimately, adults take action to try and stop the illness from spreading, whereas children have few things on their mind related to that. This means adults have nearly always been tested, whereas children have not. This means our sample has had a bias from the very beginning, and as a result, because there was not a universal testing scheme in place, we were unable to identify the full picture and have been relying on what is essentially clinical presentations. With the idea of testing everybody in mind, the fact that the FDA has granted an emergency authorization for a new test should be seen as good news. What is odd and interesting about this new test is just who funded it. The new device, which is a saliva-based test, was funded by both the NBA and the National Basketball Players Association, and was intended for public use. The research was being done at Yale, and it allowed the production of what is a very cheap and surprisingly effective test for its price point. It could be produced for as little as $4, but patients may have to pay between $15 and $20, allowing for other factors. This includes location, transport of the test kit, service providers, and so on. Unlike the other tests which are used at the moment, this is a relatively uninvasive process. The most common form of test being used at the moment are nasal swabs. They're invasive, unpleasant, and time-consuming. They also require considerably more risk for the person taking the sample. What they found when they were setting this up was that they could get very similar results to the nasal swab test with their saliva test. It also allows for results to be given in a few hours. When you compare this up to $20 test with the other option which was released back in April, you're paying considerably less. The alternative, which is produced by Rutgers, costs between $60 and $150. The price difference is possible because they removed one of the big steps, that is the extraction of RNA. In order to do this, they lose some of their sensitivity, but what they gain is speed, and they make it much cheaper. This means more tests can be done more effectively, allowing us to identify issues like we have now with children being possible significant carriers of the CCP virus. While still on the topic of the CCP virus, we should talk about one of the more interesting symptoms and how it has contributed to our better understanding of just what the CCP virus is doing. Anosmia, or the loss of sense of smell, is something we've mentioned in the past. Both in mild cases and severe cases, it seems that you lose some sense of smell in some people who have acquired the disease. Now, this is not uncommon in coronaviruses full stop. Something like the common cold or influenza does cause this. Primarily, that owes to the fact the nose becomes stuffed through mucus production that physically interferes with the movement of the odorants. What we find with the CCP virus is that that's not the case. It doesn't cause the same nasal congestion. What they do find instead, at least in this very small scale study, was that it seems to be neurological, and that fits with other evidence. We found neurological symptoms in other CCP patients, whether that's depression, PTSD, or more. In other cases, we were finding that it was interfering with cognitive functioning. The fact that it's interfering with the brain's ability to smell is a concern, as it means there's a more significant impact to the brain than we originally thought. The simple findings from their study was that the CCP virus had an effect on their ability to identify sweet or bitter flavors. This was done using taste strips. By comparison, those who had a normal cold or flu or similar were able to identify them more readily. This means that the blockages to the nose due to the common cold are not what are causing this. Among the many misconceptions that are out there, anosmia is one. Another is the bizarre theory going around that oleander could be used to treat the CCP virus. If you're fortunate not to have heard about this plant, then that is good for you. If you have heard of it, then you would know that it is one of the more toxic plants out there. In fact, you could say it's deadly. The concern here is that there's a preprint article talking about tests of the oleander in test tubes. They found that it was very effective at stopping the CCP virus from replicating. The problem is, oleander comes from the oleander plant, and the oleander plant is something that's been known about for a long time. One of the reasons it's known is that if you eat any part of it, it can cause serious heart issues. Unlike other Mediterranean plants like the olive tree and the consequential oleic acid, the oleander tree is not good for you. The oleandrin that it has within it is part of a larger family of chemicals known as cardiac glycosides. These have an unfortunate side effect of interfering with the action potential of neurons. This means that the nerves within the heart particularly are vulnerable. If they aren't receiving a signal from the brain, they'll continue to beat for a time, but this will gradually get weaker and less intense. This means less frequent heart contractions and less blood being moved each time. This can eventually lead to death in its own right, or a decrease in blood pressure, which can also be deadly. As we mentioned early on, this all comes from a preprint publication. At the moment, and especially around the CCP virus, preprint publications are not that uncommon. In fact, it can sometimes be necessary if an author feels information needs to get out into the community very quickly. It also removes some of the more common gatekeeping processes for peer-reviewed publications. In this case, the researchers identified that oleander can stop the virus particles from replicating, which, as we've pointed out before, anything at an adequate concentration will do the same thing, even bullets. This means that what is biologically relevant in a test tube may not be relevant in the larger being, or may in fact be toxic. The concern has been that people may misinterpret what has been found out with this study and try and apply it themselves without knowing the exact context. This could lead to a number of people dying due to unintended consequences of trying to treat themselves. There's also possibilities that others could try and profit, particularly those who are in the supplement industry. If not the supplement industry, then we should at least mention those who spread conspiracies and crazy theories about the CCP virus. One study looked into this, about the fake news and conspiracy theory market. They found that the CCP virus has been an absolute boon for these people. The study looked at the possible use of infectious disease and how social media plays into it. They then tried to see whether or not misinformation was circulating on particular platforms. They identified over 2,300 rumors of sorts. These were in 25 languages from 87 different countries. What they could point out was that none of the information within these was accurate or helpful. Then they were able to look at the various different rumors themselves. One in particular was the idea that you could drink alcohol intended to disinfect and it would kill the virus within you. Now, if you're familiar with your alcohols, you would know that not all alcohol is the same, and what is often in disinfecting products is certainly not intended to be consumed as a drink, and even if it were, it's more likely to be absorbed into your blood than it is to kill the virus. What this means is that at least 800 people have died. Over 5,800 were hospitalized, and 60 have become blind after drinking it as a cure for the CCP virus. They are calling this an infodemic, and they call it this because it perpetuates false cures. While on topic of false cures and studies into them, we should look at the possible use of honey and how it might be better for you than any other medications available at the moment. Honey has long been used as a treatment for things like coughs and colds. This is because it has some analgesic effects and also has some anti-inflammatory and antibiotic effects. This means that consuming it with hot water relaxes the throat and helps you to feel at least somewhat better. A systematic review looked at 14 previous studies and tried to understand whether or not there was much in the way of evidence to support that historical use. Their conclusion is that yes, it is useful for upper respiratory infections, like coughs and colds. Their only caveat to this was that much of the information they're relying on from these studies is weak. That's one of the more common issues with these meta-analyses. Most of the research included had inconsistencies, methodological flaws, and similar. That means that even though that's their conclusion that yes, it is a viable option, that should be taken with a large grain of salt. They also suggest that if nothing else, it might well be a placebo effect. That is, taking something or doing something has the same effect as actually being treated for that thing. Placebos themselves have also been in the news of sorts this week, with one large study finding that even if you know you are taking a placebo, it can still lower your emotional distress. That is, even when you know you are not taking anything that has a real effect, you still feel better. And this raises the question of, what is a medicine? While we're not going to get into that topic today, it is worth asking yourself, particularly when you're going to the doctor and asking for particular medications. The study looked at whether or not giving someone a placebo and telling them that it is a placebo would still confer beneficial effects. Most studies of any sort rely on a placebo and an active treatment. The placebo is given to people and they are told they are receiving the real medicine. It's then evaluated against the real medicine's effect and seeing whether or not people feel better having been given something or if the medication is having its intended effect. The theory being that if you tell someone they are receiving a placebo, they won't have the same benefit as if they were thinking they were taking the real medicine. At least that's how it normally works in traditional research design. This went slightly against that. They gave them the placebo and told them that it was a placebo, and then still measured them to see what was happening. While it's unlikely that at any time in the near future, giving of placebos will be the new treatment, it's good to know and may have applications for future research. While on topic of treatments and placebos, we should talk about a case study of a man who did receive a real treatment, specifically a faecal transplant. The Belgian man had an interesting syndrome. It's a relatively rare syndrome in which yeast was growing in his gut to such an extent that it would ferment alcohol. This is a slightly more common variation on a previous case study we described, where a woman who was diabetic had a yeast infection in her bladder, and once the sugars got into her bladder, it was being fermented there. In this case, it was primarily his GI tract where yeast outcompeted the other flora, and when he would consume anything with a high enough saccharide concentration, it would begin to break it down and ferment it. This is known as autobrewery syndrome. This followed a period of having been on antibiotics, and so, since yeast is not a bacterium, the antibiotics would have targeted everything but it. In the 2 months prior to presenting for this case study, the man had had periods of inebriation despite not drinking alcohol. And in fact, when they measured his blood alcohol content, he had had nothing to drink for 4 days. Despite that, his blood alcohol content was twice the legal limit. Either he had had a very good night in the 4 days prior, or he had somehow acquired alcohol into his blood in the meantime. The logical answer was that he had to somehow been producing the alcohol in his own body. His prescription of oral antifungals and a low-carbohydrate diet helped somewhat, but it didn't solve the problem in its entirety. It became a real problem when he had been ticketed for drunk driving during this period, and so doctors had to find a more serious solution. In this case, the faecal transplant. This appears to have solved his problem, and there is consideration that in the future, it might be a useful way of solving people who have autobrewery syndrome. Going from those who are having digestive issues to food that's not yet being consumed, we should talk about the bizarre case of a Swiss town who's experiencing cocoa snow? Yes, it's been snowing chocolate in parts of a Swiss town. The place is known as Olsten, and it is somewhere between Zurich and Basel. The town itself has the Lindt and Sprengli company factory there. The factory experienced a minor problem with its cooling and ventilation system for one of its cocoa products. These cocoa products being used in everything chocolate based, from those that are made from milk chocolate through to the darkest of chocolates. This led to the cocoa being expelled into the outside air, which on that period was particularly strong. This meant that there was a fine cocoa dusting on many things around the factory. This includes cars and public facilities. Lindt has offered to cover the costs of cleaning anything that's been contaminated by it, and this makes sense, given that they must know how difficult it is to remove chocolate stains. According to the company, there will be no more free samples for a while as the ventilation system has been repaired. And that's all the news we have for you this week. Thank you for watching. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you have below.